know what A1c is? If you have diabetes or somebody that you care about has diabetes, it's really important that you know what A1c means. I am Dr. Isabel from My Doctor Diabetes, internal medicine doctor and diabetes specialist. A1c is the short for hemoglobin A1c. Let me explain. We all have hemoglobin. Hemoglobin is a protein that's inside our red blood cells, and its function is to carry oxygen throughout the bloodstream. So that's what hemoglobin does. As a protein, it can get glycated, it can get sugar-coated. All proteins can bind to sugar, can be coated by sugar, and this is a non-enzymatic process. What that means is that there is no enzyme in charge of sugar coating the proteins. It just happens. If you have more sugar, you are going to be sugar coating more your proteins. And hemoglobin is not the only protein that gets glycated. In every tissue, so your collagen and elastin in your skin get glycated. Your hemoglobin gets glycated. So pretty much all proteins can undergo this non-enzymatic process of glycation. So as I told you, hemoglobin is inside the red blood cell. And the cool thing about it is that we know that red blood cells have a half-life of about 120 days. So that means around 3 months. So by measuring hemoglobin A1c, we are able to measure the exposure that this protein has had for the past 120 days. And because it is in the blood, it will tell us how much sugar there has been in the blood for the past 3 months. So it's about an average. It is not going to tell you if you had high blood sugars and then hypoglycemia. It will tell you the level of exposure of hemoglobin within that period of 3 months. So this measurement is done by a blood sample. It doesn't require fasting, which makes it really convenient. And what is it used for? Well, it has different uses in diabetes medicine. So first of all, it will help us diagnose diabetes. So if somebody gets the test done and the value is 6.5 or greater percent, that means that it is within the diabetes range. You will have to confirm this diagnosis with a second test, but that is the diabetes cutoff, 6.5 or more. If you have an A1c within the range of 5.7 and 6.4%, that will put you in the pre-diabetes range. So it can be used for diagnosis, for pre-diabetes and diabetes. It also helps us to define the goal and what treatment we should be providing in order to get that goal. So a very standard goal for patients with diabetes is to get an A1c less than 7%. If you're not getting too much hypoglycemia. So if you have an A1c of 6.8 and you do not have any hypoglycemic symptoms, you are usually within range. But talk to your doctor to define what is your goal, because it can be a little lower if you are young and low comorbidities and you have low risk of hypoglycemia, or if you are older and you have, for instance, kidney failure, the doctor might think that it's safer for you to have a higher A1c because that will put you in a lower risk of hypoglycemia. A1c can also be measured in people without diabetes, and it can help us in the study of hypoglycemia because some patients without diabetes, without taking insulin or any anti-diabetes medication, can get hypoglycemia, and that is something that we need to study. So we've gone through what A1c is, about how you don't need fasting to get it tested, and how is it used as a cutoff value for diagnosis, both pre-diabetes and diabetes. Also as a target so we can work towards a goal. Also, it can help us in the study of hypoglycemia. I hope this helps. Keep learning diabetes with my Dr. Diabetes. See you soon.